Shingles, also known as herpes zoster, is a painful and often debilitating condition caused by the activation of the varicella zoster virus, the same virus responsible for chickenpox. This condition typically manifests as a painful rash which can lead to complications if not treated promptly. Luckily, several medications can help manage the symptoms and speed up recovery. In this video, we'll walk you through the top 10 medications commonly prescribed for shingles. We'll explain how each medication works, its typical dosage, and potential side effects. Number 1. Acyclovir Zovirax. Acyclovir is one of the most commonly prescribed antiviral medications for shingles. It works by inhibiting the replication of the virus, which can help reduce the severity and duration of an outbreak. Typically, the dosage for shingles is 800 mg 5 times a day for 7 to 10 days. Starting treatment as soon as possible after the rash appears can make a significant difference in your recovery. However, like all medications, acyclovir comes with its potential side effects. Some people experience nausea, diarrhea, and headache. Despite these side effects, acyclovir is generally well tolerated and has been a staple in the treatment of shingles for many years. If you experience any severe side effects, it's important to contact your healthcare provider immediately. Number 2. Valacyclovir Valtrex. Valacyclovir is another powerful antiviral medication that is often preferred over acyclovir due to its better bioavailability. This means that a larger portion of the drug reaches the bloodstream, making it more effective at lower doses. For shingles, the typical dosage is 1,000 mg 3 times a day for 7 days. This medication can significantly reduce pain and speed up the healing process. Common side effects of valacyclovir include nausea, headache, and abdominal pain. Despite these, many patients find valacyclovir to be more convenient and effective, as it requires fewer doses per day compared to acyclovir. If you have any concerns about starting this medication, discuss them with your healthcare provider to ensure it's the right choice for you. Number 3. Famciclovir Chamber. Famciclovir is another antiviral medication used to treat shingles. It's known for its effectiveness in reducing the pain and duration of the outbreak. The usual dosage for famciclovir is 500 mg every 8 hours for 7 days. Like the other antivirals, it's most effective when started as soon as possible after the onset of symptoms. Side effects of famciclovir can include headaches, nausea, and diarrhea. While these side effects are generally mild, it's important to monitor your response to the medication and report any unusual symptoms to your doctor. Famciclovir is a reliable option for many patients, providing relief and helping to speed recovery. Number 4. Gabapentin Neurontin. Gabapentin is an anticonvulsant that is also used to treat neuropathic pain, which is a common complication of shingles. This medication helps manage the nerve pain associated with the condition, improving comfort and quality of life. The typical starting dosage is 300 mg per day, which can be gradually increased based on individual needs and response. Common side effects of gabapentin include dizziness, fatigue, and peripheral edema, or swelling of the limbs. Despite these, many patients find significant relief from nerve pain with gabapentin. It's important to follow your healthcare provider's instructions regarding dosage adjustments and to report any bothersome side effects. Number 5. Pregabalin Lyrica. Pregabalin, like gabapentin, is an anticonvulsant used to treat neuropathic pain. It's particularly effective for managing postherpetic neuralgia, a type of chronic pain that has persisted after the shingles rash has healed. The usual starting dosage for pregabalin is 150 mg per day, which can be adjusted based on effectiveness and tolerance. The side effects of pregabalin can include dizziness, sleepiness, and dry mouth. While these may be bothersome, many patients find that the benefits in pain relief outweigh the downsides. If you're struggling with nerve pain after a shingles outbreak, pregabalin might be a helpful option to discuss with your doctor. We made a book, 10 questions everyone should ask their pharmacist. You can find the link in the description below. Feel free to check it out. Number 6. Amitriptyline Alavel. Amitriptyline is a tricyclic antidepressant that is often used to manage chronic nerve pain, including the pain associated with shingles. It works by altering the levels of certain chemicals in the brain and nerves, which helps to reduce the pain signals. The typical dosage ranges from 25 to 150 milligrams per day, depending on the individual's response and tolerance. Side effects of amitriptyline can include dry mouth, blurred vision, and constipation. Despite these, it can be very effective for pain management, especially for those suffering from long-term nerve pain after shingles. It's essential to work closely with your healthcare provider to find the right dosage and to manage any side effects effectively. Number 7. Nortriptyline, Pamelor. Nortriptyline is another tricyclic antidepressant that can be used to treat nerve pain for shingles. It works similarly to amitriptyline by affecting brain chemicals that influence pain reception. The dosage typically ranges from 25 to 150 milligrams per day, and it's important to start at a lower dose and gradually increase it under medical supervision. Common side effects include dry mouth, drowsiness, and constipation. Despite these, many patients find significant relief from chronic pain with nortriptyline. It's a viable option for those who need long-term pain management following a shingles outbreak. Always consult your healthcare provider to ensure it's the best fit for your situation. Number 8. Capsaicin Cream, Zostrix. Capsaicin cream is a topical analgesic derived from chili peppers. It works by depleting substance P, a chemical involved in transmitting pain signals. Capsaicin can be applied directly to the affected area several times daily to help reduce nerve pain associated with shingles. While capsaicin is effective, it can cause a burning sensation and redness at the application site, which can be uncomfortable for some users. Despite this, it offers a non-systemic option for pain relief that can be particularly useful for those looking to avoid oral medications. Be sure to wash your hands thoroughly after applying the cream to avoid accidentally transferring it to sensitive areas. Number 9. Lidocaine Patch, Lidoderm. The lidocaine patch is a local anesthetic that provides topical pain relief. It works by numbing the skin and the underlying tissues, which can help alleviate the pain for shingles. The patch is usually applied to the skin for 12 hours on and 12 hours off. Common side effects include skin irritation and redness at the site of application. Despite these minor issues, the lidocaine patch is a convenient and effective way to manage localized pain without the need for systemic medication. It's especially useful for patients who have difficulty tolerating oral painkillers. Number 10. NSAIDs, Ibuprofen, Naproxen. Non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen and naproxen, are commonly used to reduce pain and inflammation. These medications are readily available and can be taken as needed to help manage the discomfort associated with shingles. The typical dosage for ibuprofen is 200 to 400 milligrams every 4 to 6 hours, while naproxen is usually taken at 250 to 500 milligrams twice daily. Side effects of NSAIDs can include stomach upset and, in rare cases, gastrointestinal bleeding. Despite these risks, they are often very effective in providing symptomatic relief. It's important to use these medications as directed and to discuss any concerns with your healthcare provider, especially if you have a history of gastrointestinal issues. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications. And cheers to a healthy life!